As the number of COVID-19 cases rise globally and across the world, we expect the number of cases in Singapore to also increase over time. We are therefore taking steps to preserve our healthcare capacity, and over the last few days, we have been sending our well patients who are well but still require isolation to some private hospitals, as some of you already know. Today, we have operationalized a community isolation facility with a maximum capacity of 500, and we will be sending similar patients to this facility starting from today. In addition to that, we need to continue to further step up our safe distancing measures to reduce the risk of further local transmission, as well as tighten travel restrictions to prevent import of cases, which Minister Wong will talk about later. One particular group that we are concerned about are our seniors and those with chronic conditions. We advise them to avoid social gatherings and crowded places as far as possible, and to only go out for essential purposes such as to work or to buy food and other essential items. Records from our Immigration and Checkpoint Authority show that there are still about 1,000 Singapore residents and long-term pass holders who are traveling abroad daily despite our travel advisories. These individuals pose a risk to the health of fellow Singaporeans when they return. From 27 March, any Singapore resident or long-term pass holder who disregard the prevailing travel advisory and travel overseas will be charged at unsubsidized rates for their inpatient stay at our public hospitals, should they subsequently become COVID-19 positive. Singapore residents will also not be able to claim from MediShield Life or integrated shield plans for these treatments at public and private hospitals. Even as we shore up the resources at our healthcare institutions and put in additional measures, we need every Singaporean to continue to play our part. Adhere to safe distancing measures we have put in place. Be socially responsible. If you're unwell, see a doctor and stay at home. Continue to maintain good personal hygiene. If all of us do that and work together, we can make a real difference in our fight against COVID-19. Now I'll ask Minister Wong to give his statement.
Thank you. Good evening. All over the world, millions of people nowadays are living in a different reality. The workplaces are closed, shops are empty, roads are empty, everyone is asked to stay at home. We are not experiencing this in Singapore, not yet, but we cannot be complacent. The threat of a widespread virus outbreak is very real because the imported cases are continuing to rise due to the large numbers of returning Singaporeans. And despite our best efforts to isolate these cases, to ring-fence any new clusters that pop up, the risk of local transmission will rise as we have more imported cases. So we have to take seriously the measures to protect ourselves, our family members, and the people around us. Then that's why we say safe distancing is very important in order to minimize our social activities and contacts so that we can do our part to slow down the spread of the virus. We introduced a series of measures for safe distancing last Friday. They have progressively been implemented. Adjustments are indeed taking place. I think if you go around, if you go out, you will now see that public venues are less crowded, roads are less crowded, but the adjustments are taking place too slowly. The virus is not going to wait for us. It is continuing to spread. It is circulating in our population, and anytime you can get an outbreak. It is of great concern that you still hear stories of people gathering together. You still hear anecdotes of people gathering in clubs, in discos, where there are large social gatherings, which can easily become super spreader events, and then another cluster will break out after that. So we have to make decisive moves, and we are making more decisive moves today. We are, as you would have seen in the statement, going to limit gatherings outside of work and schools to 10 persons or fewer, and ensure that physical distancing of at least 1 meter can be achieved in settings where interactions are non-transient. So with that as a guiding principle, we will close all bars and entertainment venues like nightclubs, discos, cinemas, theaters, and karaoke outlets where there is a high risk of transmission due to sustained close contact over a period of time. We will put in place restrictions on other public venues like retail malls, museums, and attractions where the contact is more transient. These venues may remain open, but with additional restrictions. We will continue to keep open food and beverage venues, but again with restrictions which we have already introduced, namely to have sufficient separation between tables, but now we will also restrict the groups of diners to be 10 persons or fewer. We will suspend all center-based tuition and enrichment activities and classes because this, again, is an activity that has lots of mingling between students, and we have to reduce such activities. We will suspend all religious services and congregations. We will cancel or defer all events and mass gatherings, regardless of size. And we advise all Singaporeans to avoid holding or participating in social events or gatherings involving more than 10 persons at any one time. This would include private celebrations like birthdays and weddings. These measures will all take effect from the 26th of March, 2359, Thursday night 2359, meaning from Friday onwards. And we expect these measures to be in place until 30th of April, so about a month or 2 incubation cycles, but it may be extended if the situation does not improve. Let me just summarize this part in Mandarin and say a few words. 为了防止新冠病毒进一步在本地扩散，我们将实行一系列新措施。首先，除了工作场所和学校之外，我们将进一步限制聚会的人数，不能超过10个人。除此之外，只要聚会中有非暂时性的接触，就必须确保每个人之间相隔至少1公尺。另外，不同的场所也将暂时关闭。受影响的包括戏院、夜总会、剧院、卡拉 OK、补习课程以及宗教活动。所有活动和大型聚会也必须延期或取消，不论人数有多少，这包括大型会议、展览、体育活动等等。这项措施将从星期四晚上11点59分生效，预计会持续到4月30号。如果病毒情况没有好转，我们可能延长措施。人与人之间保持安全距离是当务之急，我们必须通力合作，阻止病毒扩散。这些新措施会对大家的日常生活进一步造成不便，但它们是必要的。只要这么做，我们才有可能减低接下来采取更严厉措施的可能性。So these are on the tighter measures that we will put in place in order to minimize the risk of local transmission. They are necessary measures, and we hope Singaporeans take these measures seriously. Our key message to everyone, just now Minister Gan advised the elderly to stay at home, but really our key message to all Singaporeans is stay at home as much as you can. I mean, go out if you need to work, go to school, go out for essential tasks, but otherwise stay at home, reduce your social gatherings, and all other activities for the next 1 month. It's only by all of us reducing our activity level and the intensity of our contacts, that's the only way where we can significantly reduce the chance of this virus spreading further in our community. So this is a collective endeavor, and we need Singaporeans to really take this task seriously. Beyond the spread of the virus within the community, we know that many Singaporeans are concerned about returnees coming back. And the numbers, as we have highlighted, are rising. And amongst them, you will always have a proportion who are, you will see some who are infected. And because the number of returnees are rising, the base is higher, so you are seeing more and more imported cases. Amongst the returnees, the UK and the US account for the largest share of imported cases so far. And we do expect more Singaporeans and Singapore residents to come back from these two countries in response to the lockdowns that have been imposed in these places. The current arrangement for UK and US returnees are that they all have to fulfill a 14-day stay-home requirement in their place of residence. All of them would typically do so at home, and then they find a separate room to self-isolate from their family members. The current arrangement works relatively well. In fact, we have a few cases who have been confirmed cases from the returnees who are on stay-home notices. But so far, none of them have gone on to infect their family members, which means that everyone is taking the precautions seriously. They are truly self-isolating at home and even keeping a distance from their family members, which is good. But we understand that family members are still worried. Singaporeans are still worried because of the large numbers, and there is always a risk that infection can happen to a next person, to somebody in close proximity. So we are taking additional precautions even on that front. And we will now put in place a new arrangement. We are working with hotel operators to provide dedicated facilities for all returnees from America and Europe and UK to serve their 14-day stay-home requirement. So they will fulfill this in separate facilities, namely hotels which we will identify and work out suitable arrangements. So each returnee will then be isolated in their own room. They will have meals provided throughout the 14 days, and we will ensure that they avoid physical contact altogether with other individuals. These are new requirements which will be put in place for all returnees from America and the UK from 25th of March 2359. So for Singaporean parents whose children, for example, are coming back after this date, there is no need to go to the airport to fetch them, because we will work out transport arrangements from the airport. We will send all UK, US returnees to these dedicated facilities where they will serve out fully their 14-day self-isolation requirement. For all returnees who are already in Singapore, serving the SHN at home, and who may not have the best of arrangements at home, maybe the physical arrangements are not so conducive for serving out the 14-day self-isolation period, and they wish to apply for these dedicated facilities, they can do so, and we will help them to move to these dedicated facilities as well. Right, so this is an additional precaution. Like I said, the existing arrangement of staying at home is working well. Precautions are indeed being taken, but we are also doing this additional step just to ensure that all returnees coming home, particularly from these two countries where we see higher risk, all such returnees will be, upon arrival in Singapore, directly transported to a separate hotel and where they will serve out their 14-day self-isolation period in full.
I'll now ask Prof. Mark to give an update on the medical side.
Thank you very much, Minister. The press statement from the Ministry of Health will be issued later this evening and will provide more details to the information I'm going to give you now. As of the 24th of March, 2020, 12 noon, we've had an additional 49 new cases, and this brings our total number of confirmed and verified cases to 558. Of the 49 new cases, 32 of these cases were imported. In other words, they arose in travelers who came back to Singapore. Of this 32, 25 were in fact Singapore citizens or permanent residents, and additional 5 were long-term visitor pass holders. The countries in which these travelers had a travel history to included the UK, of which at least 14 of these cases had traveled to the UK, 5 had traveled to the US, and the remaining travelers had travel history to other countries, including Malaysia, France, Indonesia, and Australia, and the other countries as well. Of the 558 confirmed cases we have, 156 of these cases have been discharged, and this includes the 2 patients who had passed on. 17 cases or patients are in the ICU and they remain critically ill, and our doctors and nurses continue to look after them at this stage. Minister referred to the community isolation facility, and this is also announced in the press release that you have. The community isolation facility is located in one of our government quarantine facilities in Pasir Ris. The details are provided. And we have commenced transferring some patients across who have been discharged from the NCID to this quarantine facility. As of this evening, there will be 15 such patients transferred across. These patients are well, clinically well, and they do not actually require any significant clinical care. They have fully recovered from the COVID-19 illness, but we are unable to discharge them back to their homes in the community because they have as yet not had their test results turn negative. As such, we have taken the liberty to continue to isolate them as a precautionary move, but because they do not actually need hospital care in any of our hospitals, we've made the decision, therefore, to transfer them to this isolation facility, and they will be tested regularly in the isolation facility until they fulfill the same criteria that we had previously used to discharge our patients. Once they fulfill the 2 consecutive tests, at least 24 hours apart, and if they continue to remain clinically well, that's when we will allow them to leave the isolation facility, and they can then return home back to their previous lives. Thank you very much.
Let me just put in perspective. As you can see, the number of cases all over the world is still rising. They have not reached a peak yet, and therefore we do expect to see that the number of cases here in Singapore to also remain high, and over the next few weeks, they will continue to grow. We are likely to see more cases. At the same time, we want to put in place 2 very important measures. First, to continue to tighten our border control, and Minister Wong has just announced additional measures to ensure that SHN facilities are available for the returnees, especially from UK and US, because these 2 countries have the highest number of imported cases to Singapore. So we are managing them better in our dedicated facilities for SHN. This is a strengthened and tightened travel control, including the recently announced measures on the subsidies for healthcare facilities, MediShield Life and integrated plans policy on those who are traveling against our travel advisory. All these are stepped up measures on travel restrictions. At the same time, we also want to enhance our measures here in Singapore to further reduce the risk of local transmission. There will be local transmission, but we want to do what we can to reduce the number of local transmission. And many of these measures include safe distancing, which Minister Wong has mentioned. By the end of the day, these two measures are not enough, because at the end, every Singaporean must be responsible for our own safe distancing, for our own safety, for our own social responsibility, so that we ensure that we are safe and also ensure that those we come into contact with are safe. These may include our loved ones, our family members, our friends. So we must do all we can to change our habits, to adopt safe social habits, including safe distancing, including personal hygiene. And I think if we work together, we'll be able to manage this crisis and keep everyone safe. So thank you very much. Questions for, yeah.
Decisions today that you've announced, they are pretty much effectively a lockdown. So why don't you just go all the way, shut schools, call it a lockdown, the way other countries around the world are doing in order to reduce the number of local transmissions?
People use the word lockdown very loosely these days, and it means many things to different people. We like to think of our strategies in different categories and based on risk. At the very baseline level, there are things that we ought to do permanently. And even after COVID-19 is over, and it will be over at some stage, we have to maintain these standards. For example, things like washing our hands regularly, not using your hands to touch your face. These are all things that better public hygiene standards. These are all things that we think are important. Baseline, permanent changes. That's why we launched an SG Clean campaign. And even after COVID-19, these practices will be useful for countering any other infectious diseases as well. Beyond the baseline, we are talking about a range of, a series of measures that can be put in place throughout, or precautionary measures that can be triggered, as we say, additional breaks as and when the need arises. So we announced a series of measures last Friday around large-scale gatherings for F&B outlets to have separated seating. That's the next level of risk, and that's the next level of precautionary measures which we have introduced. Now we are putting in place a third category, or higher category, of additional precautions, including limiting gatherings to less than 10, and even closing some of these venues where we think social gatherings are likely to be concentrated. We've said that these measures will be put in place for a month. And if these measures are effective for a month and it helps to break potential transmission chains, we may then come back to Tier 2, where we were last Friday. If these measures are not effective, we may continue them for another month. We could escalate further. Escalating further would then go into the next level of measures, which would include suspension of schools and workplaces. They have to go together, because there is no point talking about, you can close a school, but people need to look after children. And if parents are working, then very hard for them to look after the children, and the children will be running around anyway in the community. So closure of schools, closure of workplaces other than essential activities, that's the most drastic step, if you will. That's what I suppose people call a lockdown. And that set of drastic measures may well be necessary, but again, we do not have to get there in one step. We can take a series of breaks, and then if the situation warrants it, then we may very well, at a later stage, we may very well have to do that. That's why we are urging all Singaporeans to take these measures seriously. if we do these steps well, then we may be able to get through this current very critical time of the infection cycle, where we are seeing a rise in imported cases, a very large wave of imported cases, and very real risk of local transmission happening. It has not happened yet in a widespread manner, and so all of these measures are really preemptive. And that perhaps is a bit of the challenge we have in getting people to take it seriously. In many countries, the very drastic measures have occurred after widespread outbreak, thousands of cases or tens of thousands of cases. We are not there, and so perhaps there is a certain sense of things are okay in Singapore, but the risks are very real, and that's what we are trying to highlight, and that's why everyone needs to take these measures seriously, and it's only with everyone, if all of us do our part, that's the only way where we can have a chance of success with these strategies.
Ministers, Faris from Bloomberg. A few questions, actually. How are you going to enforce this? Will the government resort to police officers, which you have already used, but will you go to the extent of rolling out your military personnel? Second question is, you talk about suspension of schools as the next step. But could you give, a clearer explanation of, what would be the turning point, the stage where you would be forced to suspend or close schools? Is it when there's a breakout of, widespread community transmission, or when you see that, the number of cases are still not coming down as it is right now? And the third question is, there is, of course, the debate going around the world about, whether you should close schools, open schools. Some countries did close schools. Taiwan, Australia still open schools. Is this the right approach for Singapore right now, and is it a wise decision to keep schools open?
In terms of enforcement, we are serious about enforcing these requirements, and we have multiple agencies that are involved, and that is why it's a multi-ministerial task force involving Ministry of Environment and Water Resources, which looks after our food outlets, and the police who look after the entertainment licenses for the various venues. I think the respective agencies will proceed to enforce these requirements wherever the venues comes under their charge. And we hope not to resort to the need to have a policeman or the army to be involved in enforcement. But if necessary, we will not hesitate to take enforcement action. So we really want Singaporeans to understand that we are serious about implementing and enforcing these measures. So we encourage them to work with us, and we hope we don't have to resort to enforcement actions against them. And on the schools, maybe Mr. Wong will talk about it.
We have always said you have to look at this based on the individual country's characteristics and how the infection is transmitting in that particular country. And then also on the nature of this particular disease, and then look at what are the best measures to put in place. If you look at the evidence within Singapore, we have shared this data before, a large proportion of the local transmission takes place through social gatherings. So we think it's an important, as a effective way to reduce the likely vectors for local transmission, therefore, is to reduce social gatherings, particularly in large numbers. That's why we moved with what we did last Friday, tackling large-scale events, tackling F&B outlets, and like I said, some some changes have already been made, but we do need to go further, and that's why we are moving with more decisive moves today. Do we need to take further steps? Well, then the further steps, if you think about all that we are doing, what other things have not been done? Really the two places, workplaces and schools. Those are the two other areas where activities are happening. And even there, we are not saying leave them alone. But even within these two areas, we are taking extra precautions. Schools have already suspended all their CCAs and enrichment activities. Workplaces are pushing for telecommuting, staggered hours, and having officers sit further apart. So it's not business as usual at workplaces and schools. We have taken precautions, but these are the two areas where we have not suspended any activities as of now. And so when will we trigger the next circuit breaker, if you will? Well, it's not just, as I've said before, based on the total number of cases rising, because you've got to drill down to the root cause and the underlying reasons for the cases. If the cases continue to be returnees coming back largely, and with all the precautions that we are taking, now going beyond them self-isolating at home, but even in dedicated facilities, then the risk of local transmission will be reduced. So the key consideration for us is not just the overall number of cases, but the risk of widespread community transmission of the virus within Singapore. And the data and evidence for that will be based on the number of local cases, the number of local infection clusters popping up, and whether we are able to ring fence and contain each one of them as they pop up. If we can do so well through our contact tracing and quarantine efforts, then it may well be that we could maintain at this level, and in fact, if the number of local cases come down, we may step back to where we were before. But if the number of cases, local cases, not returning imported cases, if the number of local cases continue to rise, we see new transmission chains forming and new infection clusters breaking out, and we are increasingly unable to contact trace and ring fence all of them because you're unable to detect how they are linked. Then at that point, we may well have to move to the next step and take more drastic measures.
Just to expand on the Minister's point about the schools, just to clarify, in fact, the schools have not been resting on they in fact have put in place quite a number of cohorting measures to safeguard their students. So Minister has alluded to the cessation of CCA and enrichment activities. That's also including inter-school competitions. Their classes are now organized such that students within the class sit much more widely separated than before. And there's also adjustment of the timetable so that there's staggered recesses and less opportunities for interaction across the years, so as to minimize intermingling. They've progressively moved more of their lessons into the online space, as well as to encourage much more interactions on the existing online platforms that the schools use. They've instituted regular daily temperature checks, and where necessary, when there's a travel history overseas, the student, in fact, is also placed on a leave of absence. So these are calibrated moves that the Ministry of Education have put in place for the students in the schools. And at this point in time, our assessment is that these measures continue to be appropriate. But as the risk changes over time, and if we assess that the risk to students changes, then there may be a need for adjustment of that particular posture.
Hi, I'm Chung Kiet from the Asahi Shimbun. Wanted to ask that the bars and entertainment venues will be closed for 1 month or maybe longer. So will the government be giving out any financial assistance to the operators? Thank you.
We are mindful that the COVID-19 outbreak has already impacted many businesses, and the measures we need to take to protect ourselves and to save lives, like the ones that we are introducing today, will have more economic impact as well on many F&B outlets, on the entertainment venues that have to be suspended. So these are all considerations that the government is taking into account when it designs the second package of measures, which DPM Heng will be announcing very soon. In fact, I think on Thursday this week.
So I urge reporters to be patient. By Thursday, we will share more details on the package. But I think suffice to say that the MTF, the Ministerial Task Force, has provided inputs to the Ministry of Finance with regard to the impact of these, the measures that we are introducing and the measures that we are planning. So they are mindful of the possible impact and working out the package, which will be announced on Thursday.
Hi, I'm Shamin from the Straits Times. Bars and entertainment venues will be closed. What about gyms and, for example, yoga studios? And also, because it takes a few hours to get the results of the tests to see if you have the virus, those who are being tested are apparently being called to go home first, and then if they have it, they will send an ambulance to pick them up. Why not just ask them to stay there or at the facility and wait for the results? Because, you know, when they take the taxi, sometimes, you know, they come into contact. And also, there was a preschool teacher who tested positive, and the school closed only for a day for disinfection, whereas in past, churches were closed for 2 weeks, and then after that, they closed for good. So what is the SOP on this? Thank you.
Thank you. Maybe I'll ask Prof. Mark to elaborate on this.
I'll talk a little bit about the processes associated with testing, which is a question you've asked. At this point in time, when we have performed a swab test, it takes several hours before the results comes out, and we advise people who have been swab tested then to go home, and while they're waiting for the test results, to isolate themselves and not go into crowded areas and engage in a lot of travel outside their home. And the purpose of which is to make sure that if those test results then come back positive, then there's no risk of exposure to many other people. We have considered whether or not we should allow people who are swab tested to wait around at the facility, for example, the clinic, or in the context of the airport, stay around until those results comes out. But we are mindful of the fact that if there were many people being swab tested, then that in fact then proves to be a risk in itself, because you might have people then congregating, gathering, or waiting for their test results. So on the balance of weighing that particular risk versus the advising them then to go back, we think it's in fact more prudent to let them go home and wait for the results. And when we notify them of the results, then we'll inform them whether they need them to be recalled back. We'll provide them with the ambulance that brings them then into the hospital for further treatment. You asked another question about why a school would close for a day. We actually assess each individual case on the basis of the specific details associated with that particular case. And where there is, in fact, no risk of exposure to students in the school, other staff members in the school, there is no concern that we then subsequently have about a risk of spread in that particular setting. And this may be, for example, because a particular student or staff member might have been on leave for a period of time before he or she became symptomatic, and then subsequently came to our attention and was diagnosed to have COVID-19. The concern of infection spread would generally speaking be around the period of time when he or she was symptomatic, perhaps the day before. But if he or she was never in the school during that period of time, there is no risk. And therefore, there's no routine requirement for the school then to close, and even to close for 14 days. But as a precautionary measure, the staff in the school are concerned about the well-being of their students, and to provide a further assurance to parents who otherwise would be bringing their children back to the school. Many of them may be taking a decision then to at least close the school for a day, to carry out deep cleaning activities within the school itself, to give a further assurance that in fact the school remains a safe place for their students then to come. And that may explain why the schools are closing just for a day, just for cleaning. It's not actually a requirement from the public health perspective otherwise for them to close.
Thank you. Mayuko Chani from Nikkei. I think I heard you had 49 new cases. and out of which 32 were imported. So there were 17 locally transmitted. That numbers seem to be higher compared to the last few days. Is this a concerning level that, in your opinion? And also another question is, workplace and school apart, the commercial activities like shopping malls, shops, you have introduced a very strict restriction, but you still keep it open. Why is that? With a very limited number of businesses, is it so important to keep it open?
I'll ask Minister Wong to talk about the shopping malls. With regard to the local numbers, I also asked Prof. Mark to elaborate later. Generally, we watch the number as a trend. So sometimes it goes up, sometimes it goes down. So today, we have a total of 17.
I think it's 13 additional
13
as yet unlinked.
As yet unlinked, which means out of the 17 local cases, 13 we are still continuing with the contact tracing. Some of them may have been, would have been, the link would have been found in time to come, because these are just cases as of noon today. So we are still continuing with contact tracing. But we are concerned that the numbers are high, and we will need to watch the number over the next few days to see whether the trend is sustained, whether if it is sustained at a high level, or is it going up even higher, or is it coming down. So I think we will need to continue to monitor. We shouldn't be complacent. And even if it's a low number, there's also no reason to be complacent, because there's still a large number, the rest of the world, and the risk of importation and the risk of local transmission is still there. And that is why we are stepping up these travel restrictions, as well as local transmission prevention, including safe distancing. So maybe I ask Kenneth to talk about
Minister.
local cases.
Further details will be provided in the press statement. I would refer you to those specific details when the press statement actually comes out. But Ministers are correct that we continue to be very vigilant looking at each of these cases. All cases where we cannot immediately link to another case, for example, this is a husband and wife situation, where it's quite easy to demonstrate a link very quickly. But if we're not able to do so, all cases would then be preliminarily classified as unlinked. And then we commence epidemiological investigations to determine whether or not they, in fact, had exposure to other confirmed cases, whether there's a link, in fact, with other cases or clusters. That sometimes takes a bit of time. But once the investigation is complete and we can establish such a link, these unlinked cases then get recategorized into a different category. For example, one that's linked to an individual case or cluster that may be present. There are cases where it takes a lot longer. It remains challenging to establish a link, but we nonetheless do our best to try and establish that. And as you know, we have done that after many weeks through different test modalities we've used, including serological testing. So while the numbers are higher today compared to the preceding few days, it is a concern. We continue to watch that closely, but it's still too early to determine whether this now reflects a change in the situation in Singapore, whether or not this means now that we have an increase in community spread. It's always a possibility, but we think it's a bit premature to jump to that particular conclusion just yet. We will track this, look at this more closely, and then we will perhaps give you some updates in a future press conference.
Well, our consideration for places like retail malls and attractions are that very often people who go there do not have close contacts with one another. These are transient contacts. So you go in a family, you go to a zoo, you go to a mall, you buy something, you have a meal, and you rarely get into close contact with other people, provided that place is not crowded. If that place is very crowded, then yes, you may well be, in close proximity to others. So the first requirement is that these places, be it a retail mall or an attraction, has to limit the number of people based on the criteria we've highlighted, so that you reduce crowdedness, you reduce congregations of people. So they cannot do things like have sales and have bazaars within the mall where large crowds gather. But the malls have different shops. They have F&B outlets where people still need to eat. They have pharmacies there where people may well want to buy medical supplies. So they have a range of shops, and families may want to go as individuals or in small groups just to go and access these supplies, to buy essential items and to eat, for that matter. So we won't stop that. Right? Or even if a family chooses to go to a zoo, it's outside, and just to enjoy some free time and get out of cabin fever, I think it's to be encouraged. So long as the place is not crowded, we are not allowing for close contacts, I think these places can remain. So the rules are quite strict. The retail malls and the attractions have to abide by the rules, and if they do not, if they are unable to, then indeed we may very well close these venues.
We'll take 2 to 3 more questions, please. Thank you.
Hi, Hi from Zabao here. So a few questions. So can we understand which hotels are set aside for this SHN facilities for UK and US returnees? What's the capacity like? Do they have to pay for it? Second question. So those who still insist to go overseas, if they are tested positive, they have to pay their own hospitalization fees. So can we get an understanding of what's the range of this fee like? Yeah, I understand that it varies, but can we get a rough range so people will know how much they have to pay? Third question. So the facilities that close down, does it include casino, music schools, places like this? Yeah, and last one, how many more Singaporeans are we expecting to return back to Singapore? Yep, thank you.
Okay, let me see. The first question, on which hotels? I don't have the specific hotels now. We can let you know where they are, but they will be all over Singapore in order to accommodate the US and UK returnees. Because we are talking about presently from the US and UK, 1,200 a day, staying for 14 days. So that's a large figure, right? And we will have to go to all the hotels. Fortunately, they do have bed spaces now, and we will have to work out the arrangements beyond providing bed spaces. It's also important to ensure adequate security arrangements, because we do want these returnees to stay in their rooms throughout the 14-day period. They shouldn't be outside at all. So working out not only with the arrangements with the hotels, but also with other operators, like providing security and ensuring that the transport arrangements from airport to hotel. So all that is being worked out, and we will do this without requiring the returnees to pay. Right? So this will be provided for them. The second question is on casinos and music schools. The schools, because again we have said this is tuition enrichment, I would think music schools would fall in that category, and so they will have to be suspended. Casinos will fall in the more in the category of attractions, but again, they will have to decide based on our new criteria and very strict criteria. They may well decide that it's very hard to sustain an operation with this criteria, and they may wish to curtail some of their operations. I don't know. But that's up to them to decide, right? But they fall in that category of attractions, right? So whether or not they wish to open, it's up to them. Your third question was charges for no hospitalization.
Yeah, we don't have the data on the hospitalization costs presently with us today. We'll look at it and see whether or not we can release that figure to you. But we don't have it today, so I can't release that to you.
Okay, and the last question was how many more Singaporeans are we expecting to return back?
More. No one can tell. I mean, as I said, today's figure is 1,200, US, UK combined. It may well be that this is the wave that we have seen, and then the people have already decided those who will stay, those who are coming back will come back within a day or two, and then the figure will taper off. Or it may well be that if the situation in the US, UK continues to escalate, more people may choose to come back. We do have a lot more people still in America and UK, a lot more. Whether students or people who have Singaporeans who are working there. So there is still a lot outside in these two countries. Whether they will return, we don't quite have a sense yet. But over time, as more of them contact MFA and our missions abroad, they give us an indication, then perhaps we will have a better sense. So MFA is also helping us to make that assessment.
What about the number of Singaporeans who are back across all countries? So we know that 1,002 is for UK, US. What about for all countries?
I don't have the figure with me now.
I'm Justin from Today. Just asking about the stay-home notice. I think the release talks about the enhanced penalties for these notices. But what are the penalties before today? Like, what penalties were there for people who breached the stay-home notice? What fines were there before this $10,000 maximum fine that was announced?
These penalties have always been there, right? These have not changed. So this is not an enhanced penalty today. We are just reinforcing and highlighting the fact that these penalties have always been there, including an imprisonment sentence potentially for egregious offenders. So what we are doing is we are continuing to step up enforcement. We have always been doing enforcement through remote, through the use of remote monitoring, through spot checks, but we are stepping it up and we are putting in place enhanced enforcement. So whoever is flouting SHN requirements, if they are caught, we will not hesitate to prosecute and to apply these penalties.
We'll take the last question, please.
Hi, Yufo from Newspaper. Sorry, a couple questions. One of them is on the community isolation facility. Just wondering if it's going to be staffed differently from a normal GQF, given that there are recovering patients still going to be there. Second question is, I think previously it's asked, what about gyms and like yoga studios and exercise facilities? What about them? And the last one is, given the restrictions on the gatherings and stuff, I mean, what does this mean for political activities going forward? Yeah, especially like meet people sessions or just meeting the community residents, that kind of thing. Yeah, thank you.
Thank you. On the CIF facility, I think Kenneth can elaborate. We are going to step up in terms of the infection control, because as you pointed out, these are infected patients. Although they are recovering, but they still carry virus in them. We allow them to recover in these facilities so that we can preserve the capacity in the hospitals for patients that are more sick and require higher level of medical care. And therefore, in the CIF facilities, we have stepped up measures for infection control. And there's also some minimal medical staff that will look after them, including taking swabs to test them and as well as provide some basic treatment should they need the medical services.
Yes, actually, the CIF is a repurposed government quarantine facility. And we have dedicated this government quarantine facility exclusively for these cases that have been discharged from the hospital. There's no mixing of these people with people that previously had been on quarantine and then being looked after within these or housed within these quarantine facilities. So there's no mixing. It's just these people who have been transferred out from the hospitals. The staffing for the community isolation facility is identical, therefore, to the quarantine facility with respect to the staff that are maintaining housekeeping functions, security for the place, making sure that the utilities run. So that hasn't changed. That's still the same. We have a small team from one of the hospitals that has come in to provide with advice to the operators of the facility, to give them also an assurance, to provide them with some backup in terms of what they need to do, make sure that their infection control measures remain robust. They've been doing this when they were looking after persons under quarantine. Those measures, in fact, remain the same now that the facility is now repurposed as an isolation facility. This small team do not need effectively to provide any medical care because these are all well people. When they were discharged, they were clinically well, and while they were still in the hospital, they in fact did not require any specific nursing or medical care at all. The only difference was they need the test to be done, and this test will be done once every few days. There's a team, therefore, that goes to the isolation facility to perform these swab tests. They'll bring the swabs back, I will test it, and then the test results are reviewed by the doctors back in the hospital for a decision to make whether to keep that person in the isolation facility still or to allow that person then to leave the isolation facility. In order to make sure that these people are in the isolation facility and they respect the rules, they have to stay there, they shouldn't be isolating, they are served the equivalent of a quarantine order when they are discharged. So therefore, there is in fact a legal requirement for them to stay where they are, and when they are ready, they are fit to be discharged, that quarantine order is lifted, or isolation order technically is lifted, and then they are allowed then to leave the isolation facility and return home.
The question of gyms and other activities, I think it's important to go back to the basic principles of why we are doing this. Our key objective is to reduce social gatherings and to keep them, if even there is a grouping of people, to limit them to less than 10 people. And that's why if you look at the places where we've decided ought to be closed, these are places like bars, entertainment venues, nightclubs, discos. We think these are places where it's very, very hard to avoid very close social gatherings. So have to close for a month. Eating places, yes, they gather, but people do need to eat, right? So rather than close altogether, we keep them open, the F&B outlets, but we say each dining group less than 10 persons within a family, so it's you already are exposed to one another, less than 10, and then tables are separated. And if there is an F&B outlet that has, very often it's very hard to draw these clear lines because you have F&B outlets that are like a bar, they have live entertainment, but so long as there is a live entertainment, there is live music, karaoke, these have to cease. You just run the F&B because people do need to go out to eat, or they can order takeout, but within the F&B venue, the groups have to be less than 10 and tables have to be separated. So along the same principle, gyms, yoga studios, we are not closing them, right? They are not venues where you see natural social gatherings of people all the time. You have individuals who just go to the gym and they exercise on their own, but we will uphold the principle. So if there are venues that are not able to do so, then we will have to shut them. But if there are venues that can operate while upholding these social safe distancing principles, then yes, certainly they can continue to operate. And in the same way, all political parties will have to adjust their political activities in line with these principles, right? We have highlighted the guidelines and the precautions that have to be taken. So all organizers, all companies, including all organizations, including political parties, will therefore have to adjust accordingly.